talk to you about communicating with Alzheimer's and dementia patients. One of the most stressful aspects in communicating with an Alzheimer's patient is the progressive breakdown of communication at a time when communication is more important than ever. As their cognitive abilities decline, behavior, gestures, and nonverbal sounds like tapping a finger become ways in which an Alzheimer's patient communicates. All behavior is a way of communication for an Alzheimer's patient, and communication is all about feeling for them. An Alzheimer's patient remembers with their feelings. It's not about what they can or cannot remember, it's about what they feel. The reason Alzheimer's patients communicate is to express their needs and their feelings. They communicate their physical needs, such as feeling safe, comfortable, getting their food, their water, bathroom necessities. Their identity needs, they like to feel like they're an individual, they want to be recognized, they want to have their feelings validated. They sometimes get treated like they're not there, but they really are. Social needs, they like to feel like they belong, like they're loved, like they can contribute. Their instrumental goals is getting something done for them, like getting their hair fixed a certain way. There's tips on how to communicate to them to meet their needs. You want to always approach them from the front, because if you come up from behind, you'll frighten them. You want to always identify yourself and say their name, because if you don't, they don't know who you are, and if you say their name, they know that you're talking to them. You want to maintain good eye contact and smile, because if you just walk up to them not smiling, you may frighten them. They may think something's wrong. You want to speak slowly and use short and simple sentences to keep things simple for them. And you want to speak slower because it takes them a little while longer to get it. You want to give directions simply, and you want to do one at a time. If you give them too much to think about, they're going to get lost in it. You want to be specific and use the names of objects and people. Like if you say, well, your husband Harold is coming, he will be here later. By the time you get to he, they may forget who you're talking about. You want to use correct language. You don't want to use any slangs or anything like that because they may not know what you're talking about. You want to state things in a positive way. You don't want to say no. You may get resistance. You want to always repeat a question in the same way, because if you repeat it differently, the meaning may get lost. You don't want to test the patient's memory. For instance, if they don't recognize you, you don't want to say, well, don't you remember me? Because obviously they don't. You're going to frustrate them. You want to give them plenty of time to respond. Again, their memory's a little slower. You want to use nonverbal cues sometimes, like as a touch, smile, a gesture. If you say something about brushing their teeth, for instance, they may not remember what brushing their teeth is, so you may have to literally do this just to show them that you want to brush their teeth. You want to always tell them directions step by step. You want to tell them what you're doing and how you're doing it, so again, they know what you're doing. You want to keep your tone of voice low and pleasant. If you use a high screechy voice, or if you're a little mean, again, you're going to frighten them. You don't want to appear rushed or tense, because there again, you're just going to frustrate them, because they're going to feel they're not fast enough. You want to listen to the patient. You want to find a key thought, noting their feelings or emotions, because not always the words that they say come out as what they mean. So getting to know them, getting to know their history and their past, sometimes you can pull out key words and you can figure out what they mean by that. You want to reassure through words. If they're words, you want to reassure through words. If they get frightened, you want to tell them it's okay. You're going to take care of them. You want to ask why, if you want to understand some of their repeating questions, like somebody who asks what time it is constantly. Then you want to maybe say, well, why does it concern you? And maybe then you'll know and you can tell them why. Caregivers must be educated in communication techniques, learning to observe, listen, speak, ask questions, and other alternatives in ways the patient can comprehend. The most tragic aspect of Alzheimer's disease for the patients and families is the deterioration and ultimate loss of communication. So if you have any questions, I'd be more than happy to answer them. Yes, Kit?
So if they're not having a good day, you should just try to be pleasant and let them know that you know them, so that maybe the memory might come back.
Yes, and even if the memory doesn't come back, at least be patient with them. Go along with it. You know, if they're someday in the past, you want to just go along with it. Don't try to bring them in the future, because it's not going to work. Does anybody else have any questions?
I have one.
Okay.
Are there tests that you can take before Alzheimer's or dementia even becomes into the person? Is there some kind of test that you can take before?
There's not really a lot of tests. A lot of times they don't know if you have Alzheimer's or dementia until they do an autopsy on the brain.
Oh, wow.
So, I mean, they'll do like some cognitive testing and stuff, and that they'll know that way.
Okay.
But it's hard right now to even diagnose if anybody's going to get it.
Okay, thank you.
So there's no any predetermination to find out whether or not any of us are at risk. It just may or may not happen.
Right.
Is it hereditary?
Yes, it is. Yes, it is. Okay. Anybody else have any questions? Well, if that concludes it. Thank you.
Very good.
You're a little
Very good.
overset.